This is the WHO Seminar Food Analysis for 2010, where they talk about volume, which should be greater than 1.5. They should talk about the pH, seminal fluid concentration, total sperm count, motility, morphology. Now, investigations for the tuboperitoneal factors. You could do a salpingo-furectomy, laparoscopy and dye test, sonohysterography, hysteroscopy. You could do follicoscopy, falloposcopy, and also salpingoscopy. The HSD is usually done on the 2 to 5 after the menstruation, and it's usually a contrast study. It has its advantages and drawbacks. For the ovarian factors, the investigations done could include the basal body temperature, follicle-stimulating hormone, luteinizing hormone, prolactin, estradiol, anti-Mullerian hormone, progestogens, and also the thyroid function test. Investigations for the tuber or uterine factor could be ultrasound scan, sonohysterography, hysterosalpingography, and hysteroscopy. What are the treatments? The treatment depends on the underlying cause. Usually the treatment could be non-medical, medical, surgical, and assisted reproduction. For the non-medical, generally there is what we call lifestyle modification, cessation of smoking, and stoppage of recreational drugs, and also wearing of loose underwear pants, change of jobs, and adequate coital exposure. For the females, you could also be talking about weight reduction, counseling for awareness of fertility period, and timed intercourse, and also there's a possibility of adoption. What are the medical treatments? The medical treatments usually are drugs we use for ovulation induction, such as the metformin, and also drugs for hormone replacement therapy. The surgical treatments, though are not commonly used, could also include the tuboplasty, but with the advent of assisted reproductive technology, this is not commonly done again because the success rate is not encouraging. You could also do a metroplasty, cervical dilatation, pelvic adductolysis. There are various methods of assisted reproductive technology that can be employed, such as the intrauterine insemination, in vitro fertilization and embryo transfer, the zygote intrafallopian transfer, the frozen embryo transfer, and others. What are the consequences of infertility? It has economic consequences and psychosocial problems. The economic consequences is the cost of investigation are quite expensive, the management too is quite expensive, and it tends to drain family resources. The psychosocial problems could be a source of rejection, humiliation, could even lead to depression and sometimes divorce. In conclusion, infertility is quite challenging and it is distressing to the couple, and if not properly handled, it could really result to a family psychosocial problems. Thank you.